Orbital Apex Syndrome, also known as Rollet Syndrome or Sphenoidal Syndrome, is a rare but critical condition involving dysfunction of cranial nerves as they pass through the orbital apex. This syndrome can result from trauma, neoplasms, inflammation, or infections within the sphenoid bone or orbital region. Anatomically, the orbital apex is a narrow passage located at the junction of the orbit and the cranial cavity, involving several key structures. The optic nerve, oculomotor nerve, CN3, trochlear nerve, CN4, abducens nerve, CN6, and branches of the trigeminal nerve, CNV1, are all contained within this space. Additionally, the superior orbital fissure and cavernous sinus contribute to the complex anatomy of this region. Clinically, patients present with a triad of symptoms: visual impairment, ranging from decreased visual acuity to complete blindness due to optic nerve involvement, ophthalmoplegia, or paralysis of the extraocular muscles, resulting from oculomotor, trochlear, and abducens nerve dysfunction, and pain or sensory disturbances in the forehead and upper face, stemming from involvement of the ophthalmic branch of the trigeminal nerve. For example, a patient with a compressive lesion at the orbital apex may experience progressive loss of vision, ptosis, and inability to move the eye in multiple directions. Infections like fungal sinusitis or traumatic injuries are often the culprits, especially in immunocompromised individuals. Diagnosis requires neuroimaging, particularly MRI or CT, to identify the lesion at the orbital apex. Prompt treatment depends on the underlying cause, whether it's surgical decompression, antimicrobial therapy, or management of malignancies. Recognizing orbital apex syndrome early is essential to prevent permanent damage to the optic nerve and cranial nerves. The timely intervention can preserve function and reduce long-term morbidity.